Holy Family Hospital in Bethlehem is a maternity and critical care facility serving near the birthplace of Jesus Christ. It's the referral hospital for the region for high-risk pregnancies and is a touchstone in Bethlehem, known for its compassionate, high-quality care and a preference for the poor. The hospital is the work of the Sovereign Order of Malta, a global institution operating medical, social, and humanitarian projects in over 120 countries.
The Order of Malta started many centuries ago. It was called, the whole beginning, we were the hospitallers of the Hospital of St. John of Jerusalem in Jerusalem. A bunch of very good-willed people, sort of nurses, they decided to go and live into an old hospital in Jerusalem, not very distant from the Holy Sepulchre, and they felt their mission was to welcome, care for, and give care to the pilgrims that arrived from Europe to visit the Holy Land and the Holy Sepulchre.
The mission of welcoming and caring for people of the Holy Land through the work of the hospital is special for a number of reasons, but the Holy Family Hospital of Bethlehem also stands out as an oasis of peace and ecumenical partnership in the increasingly tumultuous situation of the Holy Land.
Well, I think there are different reasons that make this place unique. I would start saying, first of all, for the people here. The general situation in Palestine is known by the public opinion. It is very difficult. There is an increasing issue of poverty. There is also an increasing issue of Christians leaving this area, which is the birthplace of Jesus. So it is very, and so the fact that we have here a real hospital, although small, but a real hospital, in which we help welcoming new lives. We are expecting between the end of December and mid-January to celebrate the 100,000th birth in this hospital. 100,000 babies will be born more or less by January in this hospital. So the idea of having, and this now we come to the Order of Malta, for the city this is very important, for all this region, the Bethlehem region, because the women here have a place where they can find all the care that they need.
The Holy Family Hospital, like all works of the Order of Malta, serves everyone without regard to creed or need, and all services are provided at a fraction of the cost or are completely free.
There are many faiths. This is an ecumenical hospital. It's an ecumenical workplace where Christians and Muslims work together to deliver and care for the babies of Bethlehem that are mostly Muslim, but they're also Christian. Everybody wears the cross of the order on their arm. And it's particularly beautiful because here in Bethlehem there's not one Christmas, but there are 3 Christmases. And there's 3 Easters. So there's lots of time where the Christian employees would like to be with their families, and the Muslim families take over so nicely. And during the holy month of Ramadan, the Christians work extra. And so it's, for staffing, it works beautiful.
The hospital has a preference for the poor, employing 2 social workers to care for the psychosocial needs of the patients and families, and to help patients with fees based on a sliding scale.
The hospital specializes in the very best care for the poor. This is a hospital that's doors are wide open to all without regard to need or creed. Every service here is subsidized by at least 50% thanks to generous donors.
Here are a few of the statistics for the Holy Family Hospital. It's run by a highly qualified staff of 172 people. There have been 96,000 deliveries since February of 1990. 4,517 deliveries in the year 2021. The infant mortality rate is less than 1%. And over 30,000 outpatient consultations and examinations are conducted per year. Since March of 2020, the Bethlehem region has faced a unique economic situation. While the COVID pandemic has been present around the world as a health crisis, in Bethlehem it has morphed into a persistent humanitarian crisis. But working a few meters from where Jesus Christ was born, Fra Alessandro finds reason for hope.
I think for humankind and for all of us, all regions of the world considered, all religions, all anthropologies, the symbol of hope is new life is a baby, a newborn baby. I say that also because I've been for more than 30 years a pediatrician. And so I understand that a small baby is a sign of hope. It brings hope. The idea that the undescribable and ununderstandable mystery of a God that is born as a baby here about 2,000 years ago.
This Christmas, let's take a moment to be grateful for Christ's birth. But let's also take a moment to remember all of the doctors and medical professionals working tirelessly to bring these small, beautiful, and helpless babies into this world, who are a sign of hope for all of us.